There still are some mysterious places in the world, and one of them is the Bermuda Triangle, in which 50 ships and 20 airplanes have disappeared. The mystery is still unknown. There are some diseases whose cause is not known, such as IBS-D, idiopathic inflammatory disease, and chronic idiopathic constipation, CIC. Let's discuss CIC in detail. How do acute and chronic constipation differ from one another? Acute, less than 3 months, and chronic constipation for more than 3 months. CIC is defined as bowel movements that are difficult to pass, do not occur frequently, or have incomplete evacuation during defecation. 10 to 17% of the world's population is affected with CIC. Among them, females and elderly have a high prevalence. However, in Pakistan, 14% of the population is affected by constipation. The factors causing chronic constipation include mechanical, metabolic, neuropathic, myopathic, and idiopathic, that is, functional. The ACG recommended gold standard criteria for the diagnosis of CIC is Rome 4 criteria. Must include 2 or more than 2 of the following with less than 25% defecations: straining, lumpy or hard stools, sensation of incomplete evacuation, sensation of anorectal sensation, manual maneuvers, less than 3 defecations in a week, loose stools rarely present without laxative use, insufficient criteria for IBS. Moreover, Bristol stool test indicates type 1 and 2 positive for the patients with CIC. In the struggle with constipation, patients often turn to laxatives, unaware of the potential negative consequences they may face, such as bloating, nausea, vomiting, diarrhea, and metabolic disturbances, especially in patients with renal involvement. Are you looking for a novel gut stimulator for your patients? Prucalopride is the right option for such patients. FDA-approved and ACG-recommended drug Prucalopride. In Pakistan, Prucalopride was approved by DRAP in 2023. Feroz Sons continues its 65+ years of legacy in the field of gastroenterology, addressing the unmet needs of patients and HCPs. Feroz Sons is proudly launching Prucalopride by the name of PruLevity, which brings levity in every bowel movement. Let's look at how PruLevity works in stimulating the gut motility. There is the Prucalopride molecule, that is, the selective 5-HT4 receptor agonist prokinetic. Prucalopride is the only FDA-approved 5-HT4 for adults for CIC. Prucalopride works on the enteric nervous system, which regulates intestinal function, including peristalsis under the epithelial layer of the colonic lumen. We can see the Prucalopride molecule. Based on in vitro studies, concentration exceeding 5-HT4 receptor affinity by 154 folds or greater. Prucalopride shows no cross-reactivity with 5-HT2A, 5-HT2B, 5-HT3 and CCK-A receptors. Prucalopride binds with higher affinity with 5-HT4 receptors being signaling cascade. These signals travel afferent neurons project upstream and selectively form synapses with excitatory motor neurons. Based on in vitro studies, these excited neurons release acetylcholine, which triggers smooth muscle cells to convert stimulating colonic motility or HAPCs or HAPCS. Clinical data supports Prucalopride has been shown to reduce colon transit time by 12 hours in adults. In 5 out of 6 trials, Prucalopride was shown to help normalize complete spontaneous bowel movement frequency (CSBM) over the period of 12 weeks. Prucalopride has improved performance with only 2% of the reported adverse effects. MACE analysis. The double-blind, placebo-controlled, and open-label studies demonstrated no increase in the risk of MACE with Prucalopride relative to polyethylene glycol (PEG). So, Prucalopride has cardiovascular safety. Prucalopride is not safe to be taken during pregnancy. Dosage of Prulevity. The dose of Prulevity for adults is 2 mg once daily, and dose in patients with severe renal impairment is 1 mg daily. Prulevity offers simple dosing to work with your patient's schedule.